Hi, my name is Dr. Streeta Diego, a local GP, paediatric doctor, and clinical lead of the Frimley Healthier Together programme. It is understandable that parents are feeling worried reading the recent headlines on group A strep and scarlet fever. However, the majority of coughs, colds, and sore throats at this time of year will still be caused by viral infections and could be self-cared at home without antibiotics. As a parent, though, how do you know? Our Scarlet Fever Group A Strep page on the Frimley Healthier Together website and Healthier Together app will help guide you. Group A Strep is a bacterial infection that lives in a lot of our throats and on our skin without causing any problems. However, in some cases, it can cause mild infections that can be treated with antibiotics, such as skin infections, tonsillitis, strep throat, or scarlet fever. The symptoms of scarlet fever are a sore throat with a high temperature, painful swollen glands in the neck, a red tongue which can have a strawberry-like appearance, and a scarlet fever rash. The rash begins on the body with small spots which then spread to the neck, arms and legs over the next couple of days. The redness of the rash is less apparent on brown and black skin, but it will still be sandpaper-like to touch. The rash doesn't appear on the face, but the cheeks can look red. If your child has scarlet fever, they do need antibiotics. However, if your child only has a runny nose, a cough, or a sore throat without a temperature, they're very unlikely to have scarlet fever or group A strep. The majority of these illnesses will be caused by viral infections that can be cared for at home with simple measures such as paracetamol, Calpol, ibuprofen, and drinking plenty of fluids to help with the symptoms. In very rare cases, group A strep can spread to other areas of the body, causing more severe infections, such as chest infections, pneumonia, or sepsis, amongst others. Regardless of the cause of the infection, whether it's a viral illness or your child is already on antibiotics, it is important that if they become pale, mottled, very cold to touch, are going blue around the lips, are too breathless to talk, eat or drink, have a fit, are extremely agitated, or very difficult to wake, develop a rash that does not disappear with pressure, or are under 3 months of age with a temperature of more than 38, you call 999 or attend your local emergency department. If your child has any of the features mentioned of scarlet fever, if they've got a temperature that is there for more than 5 days, if they're progressively getting worse and the situation is not improving, if they have not passed wee in over 12 hours, or if they have any of the other symptoms in our amber section, then you need to speak to your GP surgery today. If your GP is closed out of hours, please call 111 or visit 111 online. If your child has none of the features in the red or amber sections, then they can be self-cared for at home with a simple measure described earlier. Like with all infections, it is important to prevent spread. So catch it, always cough and sneeze into a tissue, bin it, always throw the used tissue into a bin and kill it. Always wash your hands with soap and hot water, and let's stay healthier together.